We'll hear from an expert with the Center for Healthcare Rights in Los Angeles who will help explain Medicare and Medi-Cal options. You do have choices, and we're here to help you understand them. All right, so if you're getting Supplemental Security Income, SSI, or Social Security Disability Insurance, SSDI, there are programs that can help you work and still keep your health care. Before we dive into the main presentation, we want to clear up a common fear. If I start working, I'll lose my Medi-Cal or Medicare benefits. We understand that continued health care is essential. Here's the good news. There are specific programs in place to protect your healthcare coverage while you work and earn income. So let's take a look at how this works, and starting with SSI. Briefly, Social Security has rules to protect your healthcare long term. There are three main ways for maintaining your Medi-Cal while you work and receive SSI. First, all SSI recipients automatically receive SSI-linked Medi-Cal. If you start working and still receive any amount of SSI, you can keep your Medi-Cal. To stay eligible, you must still have a disability and follow SSI rules, like keeping your resources under the $2,000 resource limit or $3,000 for a couple. There is no time limit on how long you can keep your SSI-linked Medi-Cal while you're working, right? As long as you continue to meet SSI rules, you can stay on Medi-Cal indefinitely. There are two other main programs available to help you keep Medi-Cal benefits even when you start making more money. In California, individuals can earn up to $64,517 this year in 2025, even more if you're blind, and still stay connected to free Medi-Cal through SSI under a special rule that protects your Medi-Cal known as 1619B provision. Even if your earnings are high enough to reduce your SSI cash payment to zero, you stay connected to SSI and your Medi-Cal continues. To qualify for 1619B, it's automatic. You must still be considered disabled under Social Security rules. And remember to keep those resources under $2,000 or $3,000 for a couple. And you still must need Medi-Cal to help you keep working. The good news here too is if you stop working, you're still on SSI and you can restart your benefits again without having to reapply. This rule really is intended to help you work and earn more without losing the healthcare coverage that you rely on. All right, another, and I just want to quickly mention it because our presenters are going to be going over this program in detail, but another great option is if you're working and you have a disability is the 250% Medi-Cal Working Disabled program. This special program offers free, full scope Medi-Cal for people with disabilities who work, even if your income is higher than the usual Medi-Cal limits. You can work and earn up to $79,332 this year in California and still qualify. And if you're ready to transition off SSI, but you still need Medi-Cal coverage, this may be a good option for you. You can apply through your County Department of Social Services. Right? So these programs are especially important for you if you're receiving in-home supportive services. Your in-home supportive services eligibility will continue under any of these programs so that you can safely live and work in your community. Now, just quickly, SSDI has healthcare options as well. Okay, and there are very strong protections to help you keep your Medicare while working. You can keep your Medicare for at least 93 months. That's over 7.5 years after a 9-month trial work period ends. Even if your SSDI cash benefits stop, your Medicare can continue. This protection is called the extended period of Medicare coverage. After those 93 months, you still may qualify for continued Medicare by paying a monthly premium through a program called the Medicare for People with Disabilities Who Work program. SSDI beneficiaries can also take advantage of the Medi-Cal Working Disabled program, one of the best kept secrets out there. So under this program, Medi-Cal will pay your Medicare premiums and some of your out-of-pocket expenses. So this may be a very good option to help you cover those Medicare premiums, and you can apply through your Department of Social Services. So, as you can see, and I know I went over them quickly, there are a number of work incentives that help you maintain long-term healthcare coverage. So now I'm going to turn it over to the experts who will break these options down for you. I am so pleased to introduce Robert Alley from the Center for Healthcare Rights in Los Angeles. Robert has been a dedicated health insurance counseling and advocacy program, or HICAP, insurance counselor since 2014. Thank you so much for being here.
Thank you. I'll begin. So as we've already discussed, I'm going to be going over the different healthcare options for those with disabilities, mainly about Medicare and Medi-Cal. So I do want to just provide a little bit of information about who we are. Um, so Center for Healthcare Rights is a nonprofit advocacy organization that provides free education and assistance with Medicare and other related health insurances to LA County residents. So I do believe this is probably being seen across the state, but our office specifically is for LA County. But we do have a number here for the entire state. So as long as you call the statewide number here, you'll be routed to your local office. But again, more specifically to Center for Healthcare Rights, we are not a Medicare program. We do not endorse or recommend any insurance companies or plans. We are primarily funded by the California Department of Aging under the HICAP Health Insurance Counseling and Advocacy Program. But again, here's the statewide number. That's 1-800-434-0222. So as long as you call that number within California, it'll route you to your local office as long as you're calling from a phone within that office or within that county as well. So for instance, if you're in LA, have an LA phone number and call that number, you'll be routed to our office. But if you're in Sacramento and you have a Sacramento phone number, it'll route you to that Sacramento office. And then there's our website as well, healthcarerights.org. You'll find a lot of information about us, and we have fact sheets there. A lot of this information is going to be the same across the state. There are a lot of resources there for you. So HICAP is the California version of the state health insurance program, state health insurance assistance program. It's basically just a federal program that was set up to help people with their Medicare. And then under that branch or under that umbrella, every state has their own program. And so we are the California program, again, called HICAP. And so SHIP, just like HICAP, provides one-on-one assistance, counseling, and education to Medicare beneficiaries, their families or family members and caregivers to help them understand Medicare to make informed decisions. And the Administration for Community Living oversees the SHIP program. That's part of the Health and Human Services Department. And then again, SHIP is local to the community they serve. So even though SHIP is a nationwide program, every county or every state has their own program, and usually it's divided up by county. What are we going to go over today? We're going to go over the different Medi-Cal programs and their eligibilities, the benefits and updates to Medi-Cal. We're going to go over how Medicare and Medi-Cal work together. I'm going to discuss the various options you have as a person with both Medicare and Medi-Cal. And I'm going to discuss the different Medicare savings programs, including their eligibility, the benefits, and any updates to those programs. Okay, so first of all, Medicare and Medi-Cal have very different eligibility rules. For Medicare, it's based on your age or disability status. So again, most people on Medicare are going to be 65 or older, but you can also be on Medicare as long as you have a permanent disability. So if you are on SSDI, and under 65, then you can get Medicare. Or if you have ALS or ESRD, you can also get Medicare under 65 without waiting, that is. Because if you are just on SSDI, you have to wait 2 years. But if you have ALS or ESRD, you can get Medicare basically immediately. You also have to be either a US citizen or a legal permanent resident for 5 continuous years. Medi-Cal, on the other hand, is based just on income, well, and residency. So as long as you are a resident of California and your income is under those limits, then you can qualify for Medi-Cal, regardless of age and assets, at least for now. Unfortunately, there are going to be changes to Medi-Cal next year. So here are the parts of Medicare. It looks like 4 parts here, A, B, C, and D. Really, it's just three, A, B, and D, and then C is like an optional part. Um, but I'll go over those right now. So part A is for mostly hospital services. That's what it's mostly used for if you're hospitalized. But it also covers home health care. It also covers skilled nursing in a skilled nursing facility. So for rehab after being hospitalized, essentially. And it also covers hospice. Part B is basically anything outpatient. So that would be doctor services, ambulance services, labs, x-rays, diagnostic tests, uh, durable medical equipment like a wheelchair or a walker, preventive care. So Medicare has a list of services that are considered preventive, and all of those are free immediately. You don't even have to pay your deductible. So that would be like certain vaccines, um, colonoscopies, mammograms. There's just, again, a list of services that are considered preventive that are free. You don't even have to pay your deductible. Uh, it also covers outpatient therapy, physical therapy, and then mental health services, of course. Part D, I'm going to skip over part C. Part D is just the prescription drug coverage. So that can be either like a Medicare drug plan or maybe an Advantage plan, which includes drug coverage, but it's just drug coverage. That's all it is, just the drug coverage portion. And then Part C is also known as Medicare Advantage. It's basically a managed care plan. So you join this plan and it combines A, B, and D all into one plan. So it's typically going to be an HMO, but there are a few PPOs as well. But again, the point is with an Advantage plan, you are joining a plan and they are managing your Medicare benefits for you. Okay, so the different Medicare and Medi-Cal benefits. So for most stuff, Medi-Cal will cover what's left over after Medicare pays. So Medicare is your primary insurance and Medi-Cal second. But then there are going to be services that only Medi-Cal covers. So for instance, everything on the left, Medicare is the primary payer and then Medi-Cal second. So between those two, you have full coverage. So again, that's like hospital services, doctor services, your medications, an ambulance, labs, emergency room, and mental health services. Again, these are just examples. And then on the right side, we have stuff that only Medi-Cal covers. So everything listed here are services that Medicare does not cover at all. So these are things that only Medi-Cal covers. So that'll be dental, eyeglasses. To be fair, Medicare will pay for a pair of glasses, but only after cataract surgery. Otherwise, Medicare will not pay for glasses. But Medi-Cal does. Medi-Cal will also cover hearing aids, incontinence supplies. You have unlimited transportation. So not just emergency transportation, but Medi-Cal covers non-emergency or non-emergency transportation. So if you have an appointment coming up and you don't have a ride for some reason, maybe your car's broken down, you can call your Medi-Cal plan and they have to arrange transportation for you. Medi-Cal also covers long-term services and supports. So that would be stuff such as nursing home. So if you need to be in a long-term care facility or adult daycare, or of course, personal care like IHSS, in-home supportive services. So again, these are all benefits that Medi-Cal covers, not Medicare. These are the different Medi-Cal programs for people who are age blind or disabled. I We kind of went over these a little bit earlier, or Patricia did. But the first one was SSI linked Medi-Cal, which you went over. But again, basically, as long as you have SSI, you qualify for Medi-Cal. And then there's the Aged, Blind, and Disabled Federal Poverty Level Program. So this Medi-Cal program is for people who are 65 and older or disabled. So they have different qualifying or different eligibility rules for Medi-Cal. And then there's the Aged, Blind, and Disabled Medically Needy program, which is also known as Medi-Cal with a share of cost. And then there's the 250% Working Disabled program. And so I'll go over each of these. Well, we already went over SSI Link Medi-Cal, so I'm going to go over now just the regular age and disabled Medi-Cal program. So here are the income limits. So for a single person, the income limit is 1801 a month. And for a married couple, that's 2433 a month. These are the countable income limits. It's not gross income. So there are certain deductions allowed. Um, Basically health insurance premiums. That's really it. So if you are paying for health insurance, you can deduct it from your income. And then as long as your income after paying for health insurance is under these limits, then you can qualify for full Medi-Cal. Again, this is just for California. Medicaid is a federal program as well, but every state administers it differently. So each state has their own rules. But these are the rules for California. And these income guidelines change every year. So these are this year's rules. And in California, I'm sorry, in LA, Medi-Cal is managed by DPSS. So every county has their own Medi-Cal office, and it might be a different name, but it's administered on the county level. Um, as you can see here, it does say that there's no asset limit, which is true for the rest of the year. Uh, Unfortunately, with cuts to Medicaid happening, the state of California had to adjust, had to go over their budget. So a few weeks ago, they passed a budget. And starting January 1st, there will be asset limits again for Medi-Cal. Nobody's happy about that. But unfortunately, it is being reintroduced. We haven't put it in the slide yet because again, it's not starting until next year, but just want to give you all a warning. If you haven't already heard, there are going to be asset limits reinstated. It's going back to what it was last year, back in 2023, 2024. Yeah, it's $130,000 asset limit for a single person, or 195 for a married couple, and then you add, I believe it's 65,000 for each additional family member you have. But again, for the rest of the year, there's still no asset limit. So now Medi-Cal with a share of cost, also known as the Medically Needy program. Basically, if your income is over the limits we saw on the previous page, then they have a calculation where they determine how much you would have to pay. Basically, a share of cost is just a monthly deductible. So, like I said, it is a monthly deductible, and you will have to pay that amount before Medi-Cal pays for anything. There will be examples later, but just right now, let me just say, let's say your share of cost is $1,200. Again, it's a deductible. So before Medi-Cal will pay for any medical services, you would have to meet that deductible, in this case, the $1,200 first. So you'll get billed the $1,200 by your providers. And then once you have been billed $1,200, then or paid $1,200 out of pocket for your medical services, then Medi-Cal will pick up the rest of your bills for the rest of that month, but it resets every month. This will be a little example. So Maria's income is $1,900 a month after she pays for her Medicare Part B and Part D premiums. She is single and she has a share of cost of 1,280. So that means again that she has a deductible of $1,280. So she'll have to pay that amount every month first before Medi-Cal will pay for her medical care. And then here is the calculation for how the share of cost is calculated. Um, Basically, what they do is if your income is over the limit, they subtract the maintenance need level from your income, and then that is your share of cost. Now, if you see here, these numbers don't really make any sense. For a single person, the maintenance need level is $600. So allegedly, somebody in California only needs $600 to survive, which we all know is not true. But for a single person, if your income is over the Medi-Cal limit of 1801, they take your income, subtract the $600, and then that is your share of cost. So for this person here, as we said, her income after paying for Medicare was $1,900. You get a $20 standard deduction. So everybody who applies for Medi-Cal gets to subtract $20 from their income. So that brings her down to 1880. Subtract 600 because again, the 1880 is over 1801. So now her share of cost is 1280 a month. So she's barely over the limit. And hopefully this next slide, oh, it's not here. I think it's going to be a little bit later, but there will be a slide that shows how to reduce it by purchasing more insurance. But this is again just one of the Medi-Cal programs. Um, and so there will be ways to remove that or reduce it for some people, not everybody, but some people will be able to remove that depending on their income. And then we have the working disabled program, which we kind of briefly went over, but this is specifically for people who are disabled. Okay, so in order to qualify for this program, you have to meet the federal definition of disabled. So as long as you're an SSDI, you already meet that requirement. And then you do have to meet other requirements as well, such as you do have to work um, or do some kind of work for pay. You know, when they say you work, it can really be anything. They're very lenient about what that work is. As long as you are doing something to earn money, it's a job. And then you still have to meet income limits. So there are still income limits, but they are higher. In fact, here they are. So for this program, your earned income cannot exceed 250% of the federal poverty level. That's why it's called the 250% Working Disabled Program. So that means for a single person, your income cannot exceed, your earned income cannot exceed $3,263. Or if you're married, the earned income limit is $4,403. But those are, again, not the hard numbers. So if you are working, you do have an earned income deduction. So basically only about half of your income from your job is counted. So if you're earning 2,000 a month from your job, only about 1,000 of it goes towards that earned income limit. So you do have pretty generous limits as far as being able to earn money still. Any disability income does not count towards the income limits. So if you are receiving SSDI or workers' compensation, or long-term disability or California state disability, none of that disability related income will count towards any of the income limits for this program. So, again, as long as you're able to prove that you have a job and you are disabled, then and also have disability income, then you can qualify for this program. So here are instructions on how to apply. If you already have Medi-Cal with a share of cost, it's pretty easy to apply. You just have to gather these documents and submit it to Medi-Cal, and then request them to screen you for this program. But basically, you would just need proof of your income. So whatever it is you're earning. So like if you're earning a job, if you're earning income from a job, if you have a pay stub, or if somebody's paying you to do something, they have to write a letter that says that they are paying you, and they have to say how much you're earning, what kind of job you're doing, etc. And then your proof of disability. So for most people, that will be a disability letter from Social Security, so a benefits verification letter or an award letter that states very specifically that you are receiving or were receiving some kind of disability income. So, um, for people, for instance, who are past retirement age, they may have had SSDI in the past that converted to retirement. So even though you may be currently receiving retirement benefits because it converted to retirement from disability, you can still qualify for this program as long as you can prove that you were on SSDI before it converted to retirement. So in that case, your retirement income from Social Security would still not be counted as income for this program. If you don't already have Medi-Cal with a share of cost, then you can just apply for Medi-Cal the regular way, just do an application. And then you can also send in these additional documents with your application, so that they can screen you for this program. They say that they automatically screen everybody for all programs, but I don't know if that's necessarily true for all eligibility workers. So if you are going to apply for this program and you are going to submit these documents with your application, it would be a good idea to put a little note on top saying something like, I would like to apply for the Working Disabled program, so that they know to screen you for that program. So SSDI and Medicare. So what happens to Medicare if you work? Um, Patricia did kind of go over this a little bit as well, but you do get to keep Medicare, at least normally, you do get to keep Medicare, even though you go back to work, um, if you are disabled. So you should be able to keep Medicare for up to at least 93 months after your trial work period, as long as you still have a disabling condition. So if Social Security determines that you're no longer considered disabled, they may cut off the SSDI and Medicare. But as long as you still have that disabling condition, you can still keep Medicare even if you are working. Um, you will probably not be able to keep Part A for free, so you'll have to pay for Part A. Um, but then you at least you still get to keep it. So if that is something you need, you can keep Part A and pay for it. And then of course Part B, you were always paying for anyway, unless you happen to qualify for Medi-Cal, because if you had Medi-Cal, then the state was also paying for the Part B premium. But in this instance, if you don't qualify for Medi-Cal, you would have to pay for the Part A and Part B premiums yourself if you decide to keep Medicare after losing um, your disability, or at least your SSDI, I should say. And if you need to purchase Medicare Part A for some reason, if you didn't already have it, you would have to sign up during your initial enrollment period, which is when you first turn 65. I don't think it's going to apply for most people here. Um, Otherwise, if you did not sign up when you were first eligible for Medicare Part A, you can only sign up during the general enrollment period, which is January through March. And then if you happen to have a special enrollment period, you can sign up at that point. I don't think that's going to apply to most people here, but if you delayed Medicare because you were working and had coverage through your employer instead, then you can sign up for Medicare late. But again, I don't think that's most people here. So how do Medicare and Medi-Cal work together? I did touch on this a little bit earlier. Medicare pays first, and then Medi-Cal pays second. So Medicare is the primary insurance, Medi-Cal is the secondary insurance. As long as your providers accept Medicare and Medi-Cal, you can go to any provider, any doctor in the state. You still don't need any authorization or referrals, as long as your providers accept Medicare and Medi-Cal. This is actually assuming you have original Medicare, not a Medicare Advantage plan. As long as you have original Medicare and Medi-Cal, you can go anywhere you want in the state, as long as your doctors accept both. If you have an Advantage plan, are still bound by that plan. So if you have an Advantage plan, you have to go to doctors still only part of that plan. But even if your doctors do not accept Medi-Cal, your doctors still have to see you if you are in an Advantage plan and the doctor has a contract with that Advantage plan. So again, if you have original Medicare, your doctors have to accept both Medicare and Medi-Cal for you to see them. But if you have an Advantage plan, it doesn't matter if your doctors accept Medi-Cal or not, they still have to see you regardless. So how does Medi-Cal help close the gaps in Medicare coverage? Of course, the biggest thing is that they pay your co-payments and deductibles. So somebody with Medicare and Medi-Cal should not be paying any co-pays or deductibles other than possibly a small co-pay for medications. Otherwise, all other medical co-pays are covered between Medicare and Medi-Cal. Um, for Medicare, you normally have a premium, a monthly premium of $185 for Part B. But as long as you qualify for full Medi-Cal, the state pays that Part B premium. And then, of course, as we mentioned a little bit earlier, Medi-Cal covers extra benefits that are not covered by Medicare, such as the dental, hearing aids, or incontinence supplies. We also have what's called dual eligible special needs plans. These are also known as Medi-Medi plans. It is a type of Advantage plan, which I again touched on earlier. An Advantage plan is just a managed care plan, basically an HMO. So these plans provide all of your Medicare and Medi-Cal benefits into one plan, basically. So, well, technically it's two plans, but it kind of functions as one. So you'll have a Medicare Advantage plan, the dual S&P, the dual special needs plan, and then you'll have a matching Medi-Cal plan. So for instance, if you have the Kaiser special needs plan, for Medicare and Medi-Cal, you will also have the Kaiser Medi-Cal plan. Um, but these are the various dual special needs plans. You can see most of them also have a Medi-Cal plan we saw on the previous page, except for Scan. Scan doesn't have a Medi-Cal plan, and neither does Central Health, but all the others do. But regardless, they all going to function the same. It's a dual special needs plan. They just provide your Medicare and Medi-Cal benefits into one plan, or it's all administered by one plan more or less. If you do have Medicare and Medi-Cal, you should have automatically extra help. So extra help is a program that subsidizes the cost of your medications and lowers the premium for your drug plan if you are on a drug plan that is not already free. So if you do have extra help, you are able to enroll into one of two free drug plans. There are many drug plans, but only two of them are free with this program, and those are going to be on the next slide. But the main benefit of extra help is that it lowers your copays. So somebody who has both Medicare and Medi-Cal with extra help should not be paying more than $1.60 per generic medication and no more than $4.80 per brand name medication. Again, this is all assuming that these medications are approved by your drug plan. So as long as it's on the plan's list of approved medications, this is the most you're going to pay. If the medication is not approved, you'll be charged the full price. In that case, I would recommend speaking with your doctor to see if there's an alternative that is covered by the plan, or to have your doctor contact the plan to do an exception request to get the medication approved so that you're not going to pay more than these copays here. And so, as I mentioned, there are two drug plans that are free when you have extra help. There are about 16 or 17 drug plans in total, but these are the only two that are free. So that's the WellCare Classic plan and the Cigna Healthcare Assurance plan. So if you have a different drug plan and you're paying a monthly premium for it, you can switch to one of these two so you don't have to pay a premium. So the plan will be free, and then you'll just pay those small copays we mentioned earlier. When you have extra help, you have a special enrollment period, basically the entire time you have extra help. So this means that you can change your drug plan every month, basically. But there are limits to what type of changes you can make. It's a little confusing, so we tried to put it here. Hopefully it's clear, but basically these are the changes you're allowed to make. So you can switch from an Advantage plan to Original Medicare. Okay, so if you have an Advantage plan and you don't like it anymore and you want to switch to Original Medicare, you can do that at any time. And so you'll just have to pick up a drug plan, a prescription drug plan, like one of the two that are on the previous slide. Or if you have a drug plan and you don't like it, or you just want a different one for whatever reason, you can change to any other drug plan you want. And then you can join a dual special needs plan at any time, as long as you have full Medi-Cal. So this one is specifically for people who have Medi-Cal. As long as you have full Medi-Cal, you can join or leave a dual special needs plan at any time. The one thing you cannot do with this special enrollment period, even though you have Medi-Cal and extra help, is switch to another Advantage plan. So if you have one Advantage plan, let's say, I don't know, with United Healthcare, but you want to switch to Alignment, you cannot do that because this special enrollment period is only for prescription drug coverage, the standalone drug plan. So you can leave that HMO and then join a regular drug plan, but you cannot switch from one HMO to another unless it's a dual special needs plan. So I know that is a little confusing. So if you do have any questions about those changes, you can always give us a call and we can clarify that. So there are other financial assistance programs, such as the Medicare Savings Program. So I'm going to go over that a little bit more, but basically these are programs that help pay for the Medicare premiums and sometimes your copays and deductibles, depending on which type of program you have. And then if you qualify for a Medicare Savings Program, you will automatically qualify for extra help as well. But you can apply for extra help separately. So if you don't qualify for Medi-Cal or a Medicare Savings Program, or maybe you don't want Medi-Cal or a Medicare Savings Program, you can still apply for extra help separately. And if you qualify, you will only get the help for your medications and nothing else. But I'll go over that program a little bit later. So for the Medicare savings programs, you would have to be eligible or have parts A and B, and you have to meet the income limits, and and then you would send in the application to your local county. So this is the information for LA County here, DPSS. You just find this form and then you submit it to your local office. We can also help with submitting it, but usually it's easier if you just do it because you already have the application. Just fill it out and mail it in. That's more or less what we'd be doing for you. And here are the different Medicare savings programs and their income limits. To be perfectly honest, for most people, there is no reason to apply for a Medicare savings program. The only people who really need a Medicare savings program are people who do not qualify for free Part A. So then they would want QMB, the qualified Medicare beneficiary, because if you qualify for QMB, then the state will pay for your Part A. So the people who do not have free Part A are going to be people who were disabled at a young age. So if you're on, let's say you're on SSI under 65, you don't qualify for free Part A when you do turn 65 because you don't have enough work credits. So we see a lot of people who have SSI and then they turn 65 and they only get Part B because they don't qualify for free Part A. So these people would have to apply for QMB and then they would get Part A for free. Now there have been changes to to um, to the Part A buy-in program in California. If you do not already have free Part A, as long as you qualify for SSI, you should automatically be getting it soon because they are automatically screening people who have SSI for QMB if you don't already have free Part A. So if you, for some reason, do not have free Part A and you are under these limits and you don't qualify for SSI, then you would want to apply for QMB. So again, if you don't have SSI already, but you don't qualify for free Part A for some reason because you don't have enough work credits, then you can apply for QMB. And as long as your income is under these limits, so 1325 for a single person or 1783 for a married couple, then you can qualify for this program and the state will pay for your Part A premium instead. And then also with this program, they pay your copays and deductibles. It's basically like having Medi-Cal, having QMB. Um, the other two programs, specified low income Medicare beneficiary and qualified individual, only pay for the Part B premium. So most people are not applying for these programs because if they qualify for Medi-Cal, they're already getting the Part B premium paid. So again, most people are going to have no need for one of these programs. The only people who might need one of these programs are people who do not qualify for free Part A. That's it. Everybody else would just be better off applying for Medi-Cal because it's easier to apply or it's easier to qualify for Medi-Cal than it is to qualify for any of these programs. And Medi-Cal already has more benefits than any of these programs other than QMB. So if there's any confusion about that, you can give us a call or your local HICAP office, and they should be able to help you understand that. Again, only if you don't qualify for free Part A already. So I kind of already went over this, but again, under the Medicare savings programs, all three of them pay the Part B premium. It is only QMB that pays for Part A. Um, An extra benefit, though, of having QMB if you qualify is that you are protected against balance billing nationwide. So I'll try to explain that. So balanced billing just means that you're being billed a copay when you shouldn't be being billed a copay. In California, if you have both Medicare and Medi-Cal, you are not allowed to be billed a copay for any medical services. So you do have to, of course, inform your providers that you have Medicare and Medi-Cal so they know. But as long as they know you have Medicare and Medi-Cal, you cannot be billed a copay. But that's specific to California if you have Medi-Cal. If you also qualify for QMB, then you have the federal protections as well. So you can go to any provider in the country and they're not allowed to bill you if you qualify for QMB. And then, of course, anybody who has one of these Medicare savings programs automatically qualifies for extra help as well. So you're going to get that benefit, um, helping pay for your medications. Oh, here it is again for QMB and Part A. So I touched on this earlier. Um, there were changes to the Part A buy-in and enrollment for Medicare this year. So starting January 1st of this year, you should automatically be enrolled in Part A if you are already on SSI and already have Part B. So, for instance, maybe you became eligible for Medicare when you turned 65 a few years ago, but you did not get free Part A because you're only on SSI, so you didn't have enough work credits. And maybe for some reason you did not know about QMB, so you just never applied. We see this all the time. That person starting January should have already been, by now, already been automatically enrolled into QMB and given free Part A. Because again, that person has SSI and they already have Part B. So they should have automatically been enrolled in Part A and QMB around January or February. Um, so if that's not the case, please give us a call and we can discuss that with you. You might just have to apply for QMB for some reason. But like I did mention, if you do not have SSI and you do not have free Part A for some reason, you can still get Part A for free as long as you qualify for QMB. So you just have to do a QMB application and you can do that at any time. And then as long as you are approved for QMB, you will automatically be enrolled into conditional Part A for free. So you don't have to pay for Part A. Again, you can contact us or your local HICAP office and we can try to figure out if you might be eligible and help you apply for QMB. And then, like I mentioned earlier, you can apply for extra help if you only want help with your medications. Most people would actually be better off just applying for Medi-Cal because it's easier to qualify for Medi-Cal and then you automatically get extra help. But if for some reason you don't want Medi-Cal and you just want help with your medications, you can apply with you just apply through Social Security. And here are the limits. So not only are there income limits for this program, there are asset limits. So that's why I mentioned for most people, it will just be easier to apply for Medi-Cal and then get extra help that way. Because again, the Medi-Cal limits are well, it's easier to qualify for Medi-Cal because of the of allowable deductions. And Medi-Cal, at least until the end of the year, does not have an asset limit. So a lot of people would just it would just be easier for them to get extra help through Medi-Cal, or actually it might not even be possible for somebody to apply for extra help separately, but they would get it if they applied for Medi-Cal instead, because maybe they have assets. So for a single person, the monthly income limit is about 1976, and you cannot have more than $17,600 in combined assets. If you're married, the monthly income limit is $2,664, and the asset limit is $35,130. Um, if you qualify for this program, again, you qualify for extra help, so you're you are eligible for a drug plan that is free, or if you are on a drug plan that is not free, it will be subsidized by a certain amount, so the premium should go down. But you can always, again, switch to one of the plans that are free, and then you will have no deductible at all. And then your copays are lowered. They're not going to be as low as they would be if you had Medi-Cal, but they're still low. The most you'll pay for generic medication is $4.90. And then the most you'll pay for a brand name medication is $12.15. Um, there's a little note here about the assets. The numbers you see for the asset limits here include a $1,500 per person burial expense. Um, and then the home you live in is not considered an asset. So as long as you're living in the home, so if you own the home and living in it, it's not an asset. But if you own a house, but you're not living in it for some reason, maybe you're renting it out, it is considered an asset. And then any cars you own are not considered assets, and life insurance you have is not considered an asset for this program. Here are some common questions for those who have both Medicare and Medi-Cal. My doctor's office is charging me the Medicare 20% copayment for an office visit. Do I have to pay the doctor? No. It is illegal for the doctor to balance bill you. So that's what I mentioned earlier, balance billing. Um, this doctor is supposed to bill both Medicare and Medi-Cal for the services. And even if this doctor does not accept Medi-Cal, they're not allowed to bill you. But you do need to tell the provider that you have Medi-Cal because they get to make it is their decision to see you or not. Again, if you have original Medicare. So if you have original Medicare and your provider does not accept Medi-Cal, they do not have to see you. That is their decision. But assuming they do accept Medi-Cal and they see you, you're not allowed to be billed. Um, but even if the doctor does not accept Medi-Cal, maybe you've neglected to inform the doctor of that. Once they have been informed of your Medi-Cal status, they are not allowed to bill you. But please be upfront with your doctors about this because you don't want them to be upset with you down the line. Just again, be very, very clear with them and explain that you do have both Medicare and Medi-Cal so that they can make that decision about whether or not they want to see you because that is their decision. The next question is, my doctor says that he cannot see me because he does not contract with my Medi-Cal health plan. Is this true? The answer is no. Your provider does not need authorization from your Medi-Cal plan to see you. As long as that doctor accepts both Medicare and Medi-Cal, it does not matter which Medi-Cal plan you have, they have to accept all of them. Um, so before I give, this is basically end, but I did want to go back because I thought there was another slide about the Medi-Cal share of costs. I just want to go over that really quickly. Here it is. So we mentioned, or I mentioned earlier, how when you have a share of cost, if if you're not disabled and cannot qualify for the working disabled program, you may still be able to remove the share of cost by purchasing other health insurance. Um, so I just want to use this example here. So this person, I believe her name was Maria, we can see her countable income after paying for her Medicare premiums is $1,900, but then she gets the standard $20 deduction for Medi-Cal. So now her countable income is $1,880. And as we mentioned, the Medi-Cal limit is $1,801. So that means that Maria is $79, right? If I can do math, $79 over the limit. So for her, it would be pretty easy for her to qualify for full Medi-Cal by just purchasing more health insurance. So again, she's $79 over the limit. So if she purchases $79 worth of health insurance, that can be a drug plan, like if she wants to buy a more expensive drug plan, or any kind of vision or dental or hearing plan, any combination of the three, as many as she needs. I mean, it doesn't matter as long as it's health insurance, again, so drug plan, um, dental, vision, hearing, any of those. As long as she spends $79 a month, she can show proof that she has purchased this insurance, shown how much she's paid, and then Medi-Cal will adjust her income, and then she would qualify for full Medi-Cal. She just has to continue to pay that premium every month because it is an ongoing deduction from her income. Um, and that is true for anybody who's over the limit. We have clients who, four, 500, maybe $600 over the limit. If they want to purchase that much in health insurance, they can. Medi-Cal does not care if you have 10, 20 different policies as long as you're spending that much money. So, I have clients who have a share of cost, but they want IHSS and they're three, $400 over the limit. If they really need IHSS, it would still be cheaper for them to purchase more insurance than it is for them to pay the share of cost out of pocket. I mean, the challenge is trying to find that much insurance, but assuming they can purchase that much insurance, they can do that, and then they'll qualify for full Medi-Cal. Um, so so that was just one thing I wanted to clarify here because I thought there was going to be an example of that here, but there wasn't. So otherwise, though, that is, let me see. Yeah, that was the end. Um, Here are our numbers again. You can call us at 1-800-434-0222. And then here are different Medi-Cal specific numbers. Of course, the Medi-Cal office. If you're in LA, here's the number for DPSS. There's also the Health Consumer Center of LA. They are part of Neighborhood Legal Services. They help with a lot of Medi-Cal issues. And then there's the ombudsman. If you have any problems with Medi-Cal, you can contact them. Um, but yes, we are here as well to help. So if you have any questions about your Medicare and Medi-Cal, we try our best to help with anything related to those two. So please give us a call. Um, but yeah, I guess we can go to questions now.
I was going to say, with the SSI program, that is separate from those Medi-Cal programs, right? So if you have SSI linked Medi-Cal, that asset limit remains at $2,000. If you're receiving SSDI and Medicare and you've applied for one of the other Medi-Cal programs, that would apply to you. Go ahead, Ari. One more
Oh, yeah.
group of questions.
Okay, another good one that came up was actually about the types of work. That's something that a
Mm,
lot of my clients are asking about, the type of work that can qualify somebody for the 250% working disabled program. And Robert went over some of the examples, but it's very lenient and there can be a
yeah.
lot of things that can help with people with qualifying for that program. So things like pet sitting. I had a client who was helping her neighbor organize some art supplies. I had a man who was helping his neighbor with doing some like meal preparations. So it can be a lot of things. The requirement for showing proof are quite minimal. They just really need a letter from somebody saying, describing the work that they do, and we have examples that we can help our clients. We provide our clients when applying for that program. Some of the other activities that some of my clients have done are, for example, recycling cans and
Yeah.
bottles that can also be used for that. So
Hmm.
a wide variety of things, activities can be used to qualify for the program.
Exactly. Yeah.
Okay, excellent. Excellent information. Again, I know it's complicated, but the takeaway really is here that there are experts out there to help you, right? That 800 number for high cap is going to get you connected to the high cap in your county who will understand the ins and outs of those programs. If you're in LA, it's great. You've already met two of the counselors. So, feel free to reach out to the Center for Healthcare Rights.